Hi, I'm Linda, the creator of information about arthritis. If you are new to this channel, don't forget to subscribe. Just click the subscribe button below, and then click the notifications bell to receive notification of new videos when they are released. Also, don't forget to visit my website, Food with Arthritis, where you can find out more about these terrible diseases and download free articles. The spine has 3 natural curves: the neck, middle and lumbar region. Young children can develop scoliosis, which starts in the curvature of the spine, whereas osteoporosis is a deterioration of the bone that affects the elderly. That can lead to scoliosis, meaning that one person could have both osteoporosis and scoliosis simultaneously. A spine has a natural curve in the middle, but if you develop scoliosis, your spine could become an irregular curve resembling the letter C or S, which can lead to excruciating back pain. When a child has this, it is known as idiopathic scoliosis. The first symptoms that you may notice could be a change in your back, such as a visibly curved spine. One shoulder is higher than the other. One hip may be more prominent. Your clothes may not hang properly. Your legs will have different lengths. And a prominent rib cage. Some people could have scoliosis that is caused by other conditions, for example, cerebral palsy, muscular dystrophy, Marfan syndrome, age-related, and family history. The treatment depends on age, the severity, and if it worsens in time. If your child develops scoliosis, treatment may not be necessary as it may correct itself as the child grows, but if treatment is necessary, they could have back braces or casting. The braces or casting should stop the curve from progressing, but in some cases, your child's spine may continue to curve after the treatment of braces and casts. If this happens, your child will need an operation with a metal rod in the back to stabilize the spine. The rod is lengthened at regular intervals as the child grows. The older children may wear a back brace until they stop growing, or, as in younger children, has an operation where they will put a rod in the back and attach it to the spine with screws and wires. Children and teenagers can suffer from self-esteem and depression with their pain. Osteoporosis is where the bone density weakens and can easily fracture. The bones become so brittle that falling or moving or even a cough could lead to a fracture. The areas of the body these attacks are your hips, wrists, or spine. A bone is a living tissue that replenishes broken down bones. But when you have osteoporosis, the replacement of the tissue becomes impaired. This means that the loss of old bone will take longer, or not be replaced, by new bone. Developing osteoporosis can affect men and women. But it's common in postmenopausal women, due to hormonal changes that alter bone density. At first, you could have no noticeable symptoms. However, the symptoms may occur when your bones are already weak. Then the symptoms could be: you will have pain in the back. Your posture will be stooped. Your height will gradually decrease. Your bones will be brittle and fracture easily. A young body can increase bone mass quickly, but as everyone ages, the new bone will take a long time to regenerate. This means that as we age, the process slows down, and we lose bone mass faster than it's made. Therefore, the bones break and fracture easily. All this does not mean that every older person will develop osteoporosis. It depends on some factors. You may be at high risk if any of the following is yes: a woman, Asian descent, your parent or sibling has osteoporosis, if you have a small bone structure, if you eat little calcium, unhealthy weight, gastrointestinal surgery, specific medications like steroids. Other medical conditions include celiac disease, kidney or liver disease, lupus and rheumatoid arthritis. Also, living a bad lifestyle, such as drinking too much alcohol or smoking. When your child is diagnosed with osteoporosis, it would be best to speak to their scoliosis doctor about safe, low-impact exercises. Likewise, you or your child should avoid high-impact activities, as this will affect bones and joints. The doctor may make an appointment to have an X-ray that shows any fractures. The doctor can also rule out other conditions. Children and adults could develop these terrible spine conditions that leave them with chronic back pain and spinal deformity. More studies though need to be done, on the connection between osteoporosis and scoliosis in children. Also, there needs more research on the connection between scoliosis and osteoporosis. When you think you have any symptoms, you must go and see your doctor. They will give you some tests to determine how the condition is worsening. I am not a medical professional, and the information in this article is for information only. Always consult your doctor about anything you are worried about. I hope this video has helped, and don't forget to subscribe to my channel and receive notifications when new videos are released.